Let's take a typical small business, under 50 lives. Quite often, business owners are not able to provide health care. So what folks really need is access to doctors. And about 70% of a need for a medical doctor is acute care. You know, the small things, respiratory, maybe they've got something that they could do where they could just talk to a doctor over the phone and have it taken care of in 30 minutes and run up to the dispensary, the pharmacy, and get medicine. This is affordable for business owners to pay 100% of the premium. And by doing that, it gives their employees access to something really good in the medical arena. And then there's 4 more products within MedCareComplete that back up and make the policy or the service even stronger. The best testimony I've got is my own. Waking up on a Sunday morning with my wife just in excruciating pain, and she knows it's a bladder infection. And she knows exactly what she needs, but she's got to have a physician write a prescription. Her doctor's not available. So all it is picking up your phone and going to 1-800-MD and getting a hold of a physician in 10, 15 minutes. And I'm running up to the pharmacy on a Sunday morning. You know, I can't think of a better testimony than my own. And you're wanting to find products that people need that you can deliver. And about 5 years ago, telemedicine was that item. And so we started doing a little background investigation to find out how it could be sold, how it could be delivered, and how we'd manage the program. And we actually determined that it was going to be something that a lot of insurance brokers and agents would want access to. And in seeing that and the low cost of it, we decided that we could build other products and services around it. And so we put other products and services together with it, and we found that we could protect the physical, financial, and digital health of employees. And we could deliver that service either employer paid or voluntary at a very low cost. And that's what we've done over the past several years. We continue to build upon that and look at in the marketplace to find out what the next product might be that we might add to MedCareComplete. Well, to be honest with you, a lot of small business owners, what they have in their workforce is a family. It's folks that they've grown to care about and to want to help. They're not just employees to them. And they're wanting to be able to do something. And by bringing them MedCareComplete, we've given them a product and a group of services that they can embrace and afford to give to their employees. And there's real value. And not only is there value to the employee, but the employer benefits, because if somebody is ill and we can get them back to work sooner, the other employees and the employer all benefit. And so that's what MedCareComplete's about. It's about giving tools to employers that shows the employees that they're cared about. So let's look at a little bit larger group, maybe 100 lives, that has insurance provided to the employees. Every time MedCareComplete is used, the telemedicine is used, or the pharmacy benefit is used, what it does is it keeps money in the pocket of that employee. Okay, if they have high deductibles and they can get reduced costs, say with a medical bill negotiator, and they've got a $2,000 deductible, and the negotiator is able to get $500 reduced on that, that's $500 that employee didn't have to come up with. That reduces financial stress on the employee and benefits them while they're on the job. Less stress, they're able to keep their mind on their job. That helps the employer. Other ways it helps is also being able to get them back to work quicker. Okay, even say they have a child that's sick, and they can pick up the phone and talk to a doctor, get a prescription. Okay, and not have to stay home or take 4 or 5 hours of PTO to go to a doctor's office so they can sit there for 2 hours around a bunch of sick people.
Mm-hmm.
So those are some of the things that benefit the employer as well as the employee.
Mm-hmm.
A little bit larger group where they have, they're self-funded. What that means is for every dollar in claims, that's come up to a certain amount, up to a stop loss, where another insurance company is going to pick up from that point on. That employer, every time there's a claim, that's coming directly out of their bottom line. So if we could take a zero consult fee telemedicine, okay, where there's no additional cost to the employee, and they use that several times a year, okay, that's money that they didn't have to pay additionally for and take a claim against the self-funded plan. So that's direct savings to the employer.
That's huge.
Okay. And if we have a medical bill negotiator and they're saving money on themselves, they're also slowing down when an employee or a group of employees hit their deductible and there's more exposure to the employer.
Mm-hmm.
So that's a big help to the employer.
Man, that's so big.
And there's no additional cost for that either. And that's what's good about Medicare Complete is there's one subscription price a month and no other cost to the employee. Okay? With a small business owner, where they're considering their employees their close-knit family, gives that employer an opportunity to do something special for his employees, his family members, without a great cost to them. A little bit bigger as we go into the thing about when you've got 50 lives or more, 50 or more employees, they've got to provide health insurance, the employer does. So by offering this as a voluntary basis, they're able to provide health insurance and then supplement that health insurance with a product that helps the employee. Remember I said protecting the physical, financial, and digital health of that employee. The cybersecurity package in Medicare Complete alone is worth what the employee pays for the entire package. And then you get into the larger groups, especially the self-funded, and we're able to directly impact the pocketbook of that employer by moving the risk off the employer up to a certain amount and onto Medicare Complete through the bill negotiator, through telemedicine, through a pharmacy plan.